Fact is that his big kill on the black people is the millions of people that he's allowed to come in through the border. They're taking black jobs now, and it could be 18, it could be 19, and even 20 million people. They're taking black jobs, and they're taking Hispanic jobs, and you haven't seen it yet, but you're going to see something that's going to be the worst in our history.
Welcome to Culture Shock Therapy, your health equity prescription. I'm your host, Dr. Katrina Gipson, and your guide on this journey as we unpack the nuanced headlines and policies that shape our lives. So many of us remember where we were on Thursday, June 27th, 2024. It was the first debate between former President Trump and President Biden on the presidential campaign, right? So while a lot of us were cringing for various reasons, one thing that stood out was when former President Trump stated that immigrants were taking black jobs and Hispanic jobs, right? So not only is this statement inherently anti-immigrant, it's racist and strategic. Former President Lyndon B. Johnson said, "If you can convince the lowest white man he's better than the best colored man, he won't notice you're picking his pockets. Hell, give him somebody to look down on and he'll empty his pockets for you." If the minoritized and disenfranchised are coerced into viewing each other as the enemy, it creates this distraction from a common enemy and oppressor, and that's systemic racism. This is a political strategy, divide and conquer, that has been in place in this country and in others for decades. Black voters and other targeted groups are being targeted with misinformation, such as migrants are taking your jobs and Democrats want to displace American voters. I'm sure many of you have been on social media since that tragic first debate. And well, Black Twitter and Instagram never disappoint. Many of us had plenty to say in response to Trump's idea of black jobs. So people from various industries were sharing photos or clips of themselves at their so-called black jobs, of course, with the emphasis being on people of color and underrepresented minorities performing their everyday jobs that are not considered black jobs, such as physicians, lawyers, and architects. And regardless of, your level of training or income, no one should be made to feel ashamed of the type of work that they do to support themselves and their family and to contribute to the economy, but to make the assumption that certain jobs are specifically for a certain race of people is inherently racist. So why have access to higher paying jobs or jobs requiring degrees? They've been more difficult to obtain for underrepresented and minorities due to discrimination in housing, which leads to worse public schools and making it more difficult to obtain advanced degrees. There's also discrimination in admissions and hiring processes. And also, even once people of color or groups that have been historically discriminated against achieve certain jobs, pay gaps and pay inequities exist. For instance, today, Tuesday, July 9, is Black Women's Equal Pay Day. It's a moment to take a moment and think about and reflect upon the fact that pay inequities still exist when you break down pay for the same types of job with the same types of training by race, gender. For instance, Black women can make nearly $900,000 less over her 40-year career than some of her white counterparts. And as you further, stratify these health inequity or these pay gaps, you'll see that these types of inequities still exist. If we really want to discuss the discrimination against Black and brown workers and even people of other ethnicities that immigrated to the States more recently, we have to start at the beginning, right? So the history of employment discrimination stems from centuries of chattel slavery that started in the 17th century when enslaved Africans were kidnapped to supplement the indentured European workforce. All right. So obviously, Black people have been exploited for their free labor to build the wealth that made this the most powerful empire in the world. Right. And then after the Civil War emancipation, Black codes banned Blacks from skilled trades, forcing reliance on sharecropping and farming. Obviously, these were far less lucrative forms of income, and it was written into law that Black people weren't allowed to have certain types of jobs, particularly those that were high paying. Well, fast forward to 1925. Some of you may already know this, but in that year, The Pullman Company porters from the Brotherhood of Sleeping Car Porters, or BSCP, formed the first all-Black labor union in the United States. They addressed issues such as low wages, long hours, and mistreatment from white passengers. In 1961, Executive Order 10925 establishes the EEOC. So President JFK set forth Executive Order 10925, which established the President's Committee on Equal Employment Opportunity. And then several years later, 1964, we had the Civil Rights Act that was supposed to outlaw discrimination in the workplace against protected classes, race, gender, later on to, includes things such as disabilities, etc., right? But according to a survey conducted by Gallup, 72% of Black professionals have experienced some sort of racial discrimination in this workplace. This is a higher percentage than all other groups surveyed combined. Now that we feel a little bit more comfortable with the idea that discrimination on the basis of race and many other forms of our identities is ingrained into the building of our nation and until very recently in aspects of the Constitution, we have to debunk the myth that immigrants are taking jobs specifically from Black and Hispanics. The data simply doesn't exist. For instance, under former President Trump, Black unemployment rate was 5.3% in September of 2019. Now let's fast forward to April of last year, 2023. Unemployment rate for Blacks in the United States went from 5.3% to 4.8%. To be sure, immigrants do affect our economy, right? So according to the Economic Policy Institute, the immigrant share of the labor force reached a record high of 18.6% in 2023. Although the immigrant share of the labor force reached a record high last year, the immigrant labor force growth is not occurring in some unprecedented rate as President Trump and many of his cronies would have you believe. From 2019 to 2023, the immigrant labor force grew 2.3% annually on average. That's only one third the rate the economy experienced between the years of 1996 and 2000. So to say that growth in immigrant jobs is at some unprecedented rate or surpassing the rate of U.S. citizens is simply not true. And while during both the Trump and Biden administration, Black unemployment rates decreased, Black and Hispanics and other underrepresented minority groups remained unrepresented in certain fields, particularly STEM careers or, according to the AAMC, in medicine. So AAMC defines underrepresented in medicine as Blacks, Mexican Americans, Native Americans, specifically American Indians, Native Alaskans, and Native Hawaiians, and mainland Puerto Ricans. And according to 2022, 14.4%, which is about 47.9 million people identify as Black in the United States, and 19.1% or 63.7 million identify as Hispanic. Now, it's important to remember that the term Hispanic doesn't necessarily really say much about one's race or gender, or specifically, of course, how one is perceived. But for the purposes of the AAMC definition, we're using Hispanic regardless of one's ethnicity and or race. So based upon those numbers, remember 14.4% of the population identifies as Black and 19.1% of the population identifies as Hispanic. But only 5.7% of U.S. doctors are Black and only 5.8% are Hispanic. So we remain underrepresented in medicine. Blacks, Hispanics, and other minorities being underrepresented in medicine, of course, has real impact on health outcomes. For instance, in, I believe it was April of last year, JAMA Network Open published an article that showed that Black people in counties with more Black primary care physicians have a higher life expectancy and they have lower mortality rates. That very same study showed that Blacks in these counties with more Black primary care physicians are more likely to receive preventive care and be satisfied with the care that they do receive. In addition to Black primary care physicians being appropriately represented in counties having positive outcomes for Black citizens, having an appropriate representation of Black physicians in these Black counties also showed that there were lower disparities in mortality rates between Black and white residents. The importance of physician-patient concordance. So when you live in an area where your physician looks like you, maybe you're the same race, ethnicity, religion, you share in their practice some sort of commonality. It definitely affects health outcomes for the better. Case in point, I'm an emergency medicine physician, and I was working with a resident who had a very, disparaging experience at the pediatric ED. A young Black woman brought in her Black daughter to the emergency department. She had been burned by hot water. And of course, anytime there's, some sort of injury or trauma to a child, we have to consider child abuse. So some questions were asked, and the mom explained to the physicians that she just finished braiding her daughter's hair. And, in order to seal it, you have to dip the hair in the boiling water. Something happened. It spilled. It turned over. And these physicians, who happen to not be Black, were not familiar with this practice, perhaps to no fault of their own, but nonetheless made the false conclusion that this mom was lying. There's concerns of child abuse. Conversations were had, and things escalated from there. And this is all due to a lack of maybe cultural concordance or familiarity with different Black styles and how we take care of those styles. So while eventually things were all worked out, these are things that can be ameliorated by not only having more Black physicians, but increasing cultural humility and awareness amongst all types of physicians. I mean, I'm sure that I have my own implicit biases and lack of information and understanding about certain cultures, including the cultures of some of the patients that I take care of. But we at least need to know that we don't know in order to take better care of patients, regardless of their race, gender, ethnicity, or socioeconomic status. All right. My job is more than just to introduce you to these problems and issues and, throw our hands up in despair. Let's take some steps towards health equity. One of the most important things that I can encourage you all to do, particularly in this presidential election year, is to register to vote. Okay. Civic engagement is important. It impacts the policies that influence how we live our lives and access health care. However, elections are about more than just presidential elections. However, we see how important presidential elections are. They're the ones who appoint SCOTUS, the Supreme Court of the United States. And just in the last couple of years, we've seen the devastating impacts, what can happen when a right-wing or extremely conservative SCOTUS is appointed. In the last few years, we've woken up for the first time with rights that our mothers and grandmothers went to sleep with. And that was the right to access abortion, which is a form of health care. But in addition to voting for your president, I think it's important to realize you should also keep in mind that other elections are important as well. Case in point. So state legislators or governors often elect the board of trustees for public universities that can highly influence how our kids receive their higher education. Or what about election of local school board members? We've seen how over the last several years, the right wing has been, flooding school board elections for the purposes, swaying the vote and influencing the types of books that your children are allowed to access, whose history that we're allowed to learn. All of these elections have implications on how we're educated, how we receive our health care, the type of access to which we have health care. It's more than just a presidential election. If you're not already registered to vote or you're not sure how to vote in your area, sign on to USA.gov, type in your zip code, and figure out what you need to do, what type of identification that you need in order to register to vote, because your life could literally depend upon it. And we're seeing that now. One of the many ways that we can address inequitable health outcomes in healthcare is to support underrepresented minorities in STEM careers, science, technology, engineering, and medicine. Some of the ways that you can do this at maybe a more grassroots level is ensuring that underrepresented minorities have access to support and opportunities leading to careers in STEM and medicine. Make sure that you're donating your time and or your funds to organizations, not-for-profits, churches that mentor students and give them opportunities to make sure that they're successful in school, exposed to STEM careers early, and have mentors in STEM who look like them. Difficult to achieve something if you don't see it. If you're already a person of color or anyone for that matter in a STEM career, make sure you're mentoring someone, whether they be locally, on Zoom. The possibilities are endless. Our long-term goals are to achieve an equitable healthcare system where your social drivers of health do not negatively impact your health outcomes. Many ways to do that, including vote for elected officials who support DEI in education and medicine. The last couple of years, we've seen an attack on DEI, both the public and private sector, and we need to hold our public officials accountable for their behavior and the way that they vote. Support HBCUs, historically Black colleges and universities. For instance, Howard and Meharry are responsible for over 80% of Black physicians. We want to make sure that they have the opportunity to continue to educate tomorrow's futures and leaders. And of course, not all people of color can go to HBCUs. Make sure that mentoring programs, scholarships are available for people of color, underrepresented minorities to access opportunities in higher education with your vote, your voice, and your pocketbook if you're able. I also encourage my patients and listeners to learn to advocate for yourself. Accompany family members to a doctor's appointment. Make a list of questions beforehand. White coat hypertension and anxiety is a real thing. Empower yourself by writing a list of questions to keep yourself focused and make sure that your needs are met and that all of your concerns are addressed as reasonable when you go to your doctors. Also, regardless of your specialty, your level of interest and your engagement, I think it's important to stay up to date on issues that are going on as far as health policy. A quick and easy way to start is health.gov, which is sponsored by the U.S. Department of Health and Human Services. Other more medically related websites are MedPage Today, Stat News, The Hill, and Politico also are publications that can keep you informed on what's going on in health policy and how your elected officials are using your time and money and making your voices heard. Despite what former President Trump may think, there are no Black jobs, there are no white jobs, and there are no Hispanic jobs. However, we do need to work to ensure that resources remain in place so that all people can access all types of jobs, regardless of their ethnicity, their race, their gender, their sexual orientation, or their disability status. We also need to work to make sure that people receive equitable pay for equitable work, regardless of their race, gender, etc. And immigrants contribute to a more robust and strong economy. All right, everybody, stay safe, stay cool out there, and stay tuned for more Culture Shock Therapy, your health equity prescription with your host, Dr. Katrina Gipson. Thanks for joining us.